Welcome to the Mindful Healers podcast with Dr. Jessie Mahoney.
And Dr. Ni-Cheng Liang.
We are physicians and leaders who are also trained in coaching, yoga, mindfulness, and integrative medicine.
We are also mothers, spouses, sisters, daughters, aunts, and friends.
In this podcast, we share candid, heart-centered, loving, science-based, thoughtful, and often fun conversations about the challenges life throws at us.
With our collective experience of over 30 years in physician and personal wellness, we reflect and offer pearls of wisdom for navigating life's challenges with more ease.
From parenting, marriages, money scarcity, cancer survivorship, uncertainty, challenges in practicing medicine, we cover it all.
We invite you to refresh your perspective and empower yourself with mindset, mindfulness, and other well-being tools that actually work. A quick reminder that nothing in our podcast is medical advice.
Welcome to today's episode, when you don't want to be that patient.
Have you been a patient? Have there been thoughts of, oh, I can tough this out, or I don't really want to bother them with regards to your own healthcare needs? The intention for today is to normalize that it can be tough for healers, especially, to seek timely medical attention for themselves for a multitude of reasons. We hope to name some of the potential causes for this and how to take sooner action in addressing our own healthcare needs. So I'd like to invite everyone to take a moment to pause before we get into the meat of the episode, settling in. If it serves and is safe for you to do so, inviting you to close your eyes or lowering your gaze a few inches in front of you, noticing the support of the ground beneath your feet, the chair if you happen to be sitting on something, allowing the body and the mind to catch up with each other so that they're here together at the same place at the same time, ready to receive and be open. And as you're ready, blinking open eyes, letting the light back in. So I wanted to start off with naming the fact that in medical school and residency and fellowship, and even as attendings, many of us have been working in a culture where it's ingrained in us, you show up for your shift no matter what. There was an expectation that the only time you would call out sick was if you were so sick that you were bedbound. And I remember my senior residents telling me to eat, pee, and sleep when I could during call. And so this has been a really deep indoctrinating of putting others' needs above my own. And this has been decades old, and it's very deeply entrenched. However, it's hard, but necessary to change this and break free of the old conditioning. And maybe I also want to name that maybe one of the silver linings of COVID has been that healthcare professionals were finally advised to not show up to work if they were sick. That us showing up would actually harm others and, of course, also harm ourselves. So, Jessie, will you share a little bit about the inspiration for this episode? Because this is a very recent inspiration.
So the inspiration for this episode came from my recent illness, and I was on day 18 of being ill and had been thinking probably for about, 7 to 8 days that I should probably call and get antibiotics, that I had waited a long time and actually had been sick, got better, and got sicker, which is, of course, as all of us in medicine know, a clue that perhaps some secondary infection is going on. But I didn't want to call, and I didn't want to bother anyone. I didn't want to ask for help. And I didn't want to be, as I called Ni-Cheng and texted her actually at one point and said, I don't want to be that patient, in quotes, the one who messages and says, okay, now I need antibiotics, haven't been in. And so that's the root of this episode. But in thinking about it, it goes so much farther than that, because it's not just not showing up when you're sick. It's what do you do when you're sick? And we don't allow ourselves to be human and be sick and have that weakness. We think we should get better faster than everyone else. I've talked about that a few times on this podcast. And we have a lot of trouble being a patient when we are a physician. And it's complicated. I want to offer being a physician who's also a patient, because we know so much more and we have background. And so we're coming to it from a totally different lens. But I think what gets in the way more than that lens is our own judgments and our own stories and our own culture. And so we wanted to talk about the challenges of being a patient when you're a physician, and especially a patient who doesn't want to be that patient. And for me, that patient is the one who's whining or asking for too much. Or, in peds, we get a lot of emails asking for antibiotics when it's not quite time, or when they haven't been seen, or any number of those things. And so I think in my mind, there's just that patient, which is kind of funny that we even use that language, because we don't even know what it means, except that it's this like inner discomfort about being someone asking for help, perhaps inappropriately, or perhaps for fear of being judged. Many of us also don't want to bother our colleagues because we know how busy they are. We know how hard it is. And to add to their schedule, or to add to, I have to say, every time I go to secure message my doctor, I feel guilty because I know she has 47 emails. And so I'm hoping that mine is the shortest, fastest one. And so I try to be, not long-winded, but clear, and ask specifically. But again, it's my brain sort of trying to do 5 layers of the work to make it easy on her. We also really struggle to advocate for ourselves. And whether it's a sense of worth, I think for some people, for me, I don't, funny, I definitely fear judgment. Like, I don't want someone to be like, oh, she's just asking for antibiotics. Doesn't she know that? Or she thinks she's special, or any of those things. So I did not only ask you, I asked like 4 people, is it okay to email and ask for antibiotics, even though you're the pulmonologist? And every person I asked was like, oh my God, you should have asked last week. Why are you still out here doing this? And so I just think for me, I think there is that fear of judgment. There's also a fear of kind of being vulnerable and needing something and worrying that somehow you won't get it. Although we should all know that if we don't ask, we definitely won't get it. And then for me, there's that knowledge that the system is so broken. And so I might send an email and nobody will see it. Or when I sent it, my doctor was on vacation. So some poor covering doctor who's covering her basket and their basket had to answer it. And then they don't know you, and who knows how they'll judge you, and will they help you? And I've had a lot of trauma, which we'll talk about a little bit later, about being very vulnerable and needing help in a hospital setting or needing help in a medical setting, and not being able to get it, even though I knew how the system works. And so I think many of us, it's almost easier literally not to ask, which is not necessarily healthy. But I think the flip side of worrying about how we might be perceived as a patient, and this came up as I was thinking about this podcast, is you also don't want to be that patient who ends up hypoxic in the ER, who never came in for their antibiotics, or ends up in one of the other places I'll talk about later with, a blood clot and needing to go to the ICU. You don't want to be that patient, and I have been that patient. So it's a bit of balancing the two. And I think our overactive medical minds really keep it challenging.
I am also, with loving amusement, going to call out that, like, I had heard that you were sick like a couple weeks ago, and then I hadn't heard anything. So I just presumed that you had gotten better. And then you texted me that you had been on like day 14 or 16 or something, well beyond the required time of waiting to see if it became a bacterial superinfection. And here I was, I'm like, but I'm the pulmonologist. So so I just got to put it out there that Asking for help definitely helps, especially if you happen to have a respiratory issue and one of your hopefully dear friends is a pulmonologist. That I give you permission to ask me much sooner.
Fair
I was like,
enough.
oh, you're still sick. Oh, you're like worse. Oh, like so yeah, I with loving
What's
amusement.
interesting is that, I felt guilty asking for help, but probably the point when I asked for help was when I also felt guilty living in my own house and having everyone listen to me and, waking people up at night because I was coughing all night. And so it was sort of that balance of like, wow, I'm inconveniencing people no matter what I do now. I better do something.
Mm-hmm.
That's, I think, the acculturation as a physician. We just don't ask.
Yeah, and there is something to be said about many people saying, oh, physicians are the worst patients. I think there is actually some truth to that, unfortunately. But like what we're trying to do with this podcast, one listener, one podcast, one sentence at a time, is to try to like invite change from multiple levels. And so I think change starts with us, and as easy as asking for antibiotics when it's appropriate to ask for antibiotics.
Yeah. Well, and I want to touch back on this idea of being that patient, because that strikes me as a systemic issue too, right? We in medicine, and for those of you listening who might not be in medicine, we do talk about, oh, that patient, or the patient who's complaining, or the patient who's advocating inappropriately, because we're trained to sort of judge things, but also because we are all way over capacity. And so understanding that the system's not working, and so therefore our own sort of self-protective mechanisms are sort of judging who should be filtering to the top, who shouldn't, and who's advocating perhaps too loudly. And that, I don't think it's anyone's fault, but it was so interesting to me that that was what I was worried about.
Mm-hmm. Yeah. Well, I'm glad that you got the care and the help that you needed, and that you're feeling better, most importantly, and that you're well enough to record today's episode, because this is like very recent.
Yeah.
So thank you for being willing to be vulnerable in sharing your most recent experience of being a patient. So, probably not that patient.
Yeah. Well, what is your version? Because when I said I don't want to be that patient, you immediately said, when you're better, we need to do a podcast on that patient. So you have in your mind what that means for you.
Yeah, I think that there have been multiple times in my life where I have been a patient. I hope that I have not been, quote unquote, that patient. But even if I have, I'm super grateful that I've received the care that I have needed in mostly a timely manner. And if it wasn't in a timely manner, it was really due to the very intentional decisions that I made. So I'll start off with my more recent one. And I think you remember this episode. A couple months ago, I went to the emergency room. Like I checked myself in because I had been having chest pain. And the chest pain was such that it was left-sided and sometimes exertional, and sometimes worse with coughing, and sometimes worse with deep breaths. And all of those things kind of like had red flag signs. So it took a while for me to finally be like, okay, you know what? This chest pain is not going away. I need to check myself in because this is chest pain. But I really did feel guilty because most likely I knew that the chest pain was going to end up being something not life-threatening, but I didn't have any objective evidence to prove that. I even remember telling the emergency medicine physician, oh, I'm so sorry. And he's like, why? You have chest pain. So just to remember that, yeah, common things are still common. And yet when those red flag symptoms show up in ourselves, why did I minimize those red flag symptoms in myself? Like I had every right to be there, just like a person who had the broken leg in the room next to me, for instance. The other thing also was I knew that it was a very, very busy time of year and the emergency room was already overflowing. They didn't have any more beds in the emergency room. And so there were gurneys out in the hallway. And so I just like hung out on a gurney in the hallway. And as nurses passed by and took care of me, I also was feeling bad and apologizing. And I felt this constant need to justify why I was there. But really, in retrospect, there was really no need. I had freaking chest pain. Like when our patients call in to triage lines, when they email us with chest pain, what's like one of the first things that you advise them to do after going through a series of triage questions, right? So that was my first more recent episode of potentially having waited too long and being that patient on the other side of the pendulum, but then actually getting care and then being afraid of being that patient, of like taking up resources when somehow I didn't feel like I was worthy of taking up those resources, when in fact I really actually was with chest pain.
And notice so you brought up the worthiness, right?
Yeah.
Any of us struggle. Am I worthy of the resources? And notice your stories about the limited resources and the scarcity of resources, and therefore you shouldn't take them, and how busy a time of year it is, which is exactly the kind of justifications that we use. And then we have to justify why we went. And notice that I often call it a trauma response. We have to give all the reasons, like I did this and I did that and I did this and I did that, which were in my email when I requested antibiotics, just to be clear. But I think it is a bit of a trauma response that we have to justify. It's okay for me to be here. And notice also how much apologizing you did when it wasn't your fault, right? You wish you weren't there, but you shouldn't necessarily have been sorry that you came in, or sorry
exactly.
to take up
like there was no need for that sort of reaction. I mean, I had chest pain, period, end of story. Like, therefore,
kindness and compassion that we just don't like going in to get medical care, and we worry about the judgment of others. And that's and we know how the system works, and we know how stretched it is. And so just the hand to heart that it's hard for physicians who understand the complexity of it to go in, and that's fair and reasonable. Doesn't mean we shouldn't, but it makes us human.
Absolutely. Embracing all of that. And our more recent work in terms of mindfulness and coaching has been much more recent compared to the decades of this type of indoctrination. And so just self-compassion there, in terms of like, it takes time for true lasting change on a very foundational level when we've undergone so much already. It doesn't give us an excuse for not seeking the care that we need, but self-compassion there for sure. And I also wanted to add about my own cancer survivorship. So the timeliness of the care that I got actually was pretty on time. I'm actually pretty proud of myself in retrospect that once I noticed a lump that I did go in, I didn't try to minimize and poo-poo that. Even though in my mind I was already like, oh, the likelihood of this lump being something malignant is very low, because I was 31 at the time. But I'm still glad that I went in and went through the motions, and of course the motions led to a very serious cancer diagnosis. And so I feel like even though I've had that experience of being the patient that was quote unquote good and sought care appropriately in the appropriate time, you can see how old patterns and false beliefs and old storylines can just creep right on in, even after more than a decade of that pretty intensive cancer experience. And I like,
what got you to go in so quickly then? What was the mindset there?
So we have to go back a bit, because luckily I am now a 13 plus year cancer survivor. I just had my 13th cancerversary in May. So the mindset back then was, I better go in, partly because my baby at the time was so young, right? And so God forbid if it was something more serious and I missed it and I waited, that there would be a mom to take care of this baby. And so I think it was as a result of
someone else again.
Exactly. Someone else's needs, right?
Making me go in for us. Yeah.
Making me go in. And then actually, yeah, the worst case scenario did actually happen. So but I say this now 13 plus years later, that cancer was the teacher that I didn't know I needed. And it's never ceases to continue to be the very generous teacher for the rest of my life. And it's ongoing, right? As soon as you have a cancer diagnosis, you become a cancer survivor for life, or a thriver if you're dealing with metastatic disease. And for those of us who have become longer term cancer survivors, it's really the cost of survivorship and the scares and the surveillance, the scanxiety that we've talked about in prior podcasts before, the anxiety leading up to test results for the rest of our lives, and getting kind of sort of used to, but never really getting used to the cancer scares that are at this point too numerous to count. And I'm grateful to say that as I've lived farther and farther out from my initial cancer diagnosis, the scares have definitely decreased. Very, very, very grateful to that for that. And yet, here I just shared with you about the chest pain episode that I just had.
What's the difference? Because it's very interesting as an observer. When you've had a cancer scare, as long as I have known you, you have zero hesitation to go in, zero judgment to reach out. But when you have chest pain, both of them could kill you, by the way, right? Especially in women. What's different?
Yeah, I don't know that I can pinpoint it. And then certainly if we want to delve a little deeper, the differential diagnoses of chest pain in a cancer survivor related to cancer are also multifold. And so I think also, as I'm talking about it, maybe there was some component of a little bit of denial that, like, oh gosh, if it ended up being something metastatic, is it something that I don't really want to know about, like, right away? Like, there was still some fear of the unknown that was hidden in there, and trying to postpone that, trying to minimize that, and waiting and seeing a little bit too much of that. So I think it was all kind of intertwined in that. But the initial thinking behind the chest pain, looking back now, it didn't include, luckily, so much of the possibilities related to cancer, even though one of the first things I did actually was to email my oncologist after the emergency room visit. And that actually did lead to a breast MRI to make sure that everything was looking okay.
One thought I have here is that your brain says it's okay if it's potentially related to cancer, but not okay if it's something else, which is just interesting that you're judging the value of different illnesses as well.
Yeah, there's like a hierarchy of illness and what's like worthy of seeking care.
Yeah.
My own,
I think we should just hand ourselves for our awesome stories that we have.
Yeah, right. Our own.
I actually do the opposite, though. See, if I think it's life-threatening, I'm definitely going to stay home because I definitely don't want to know, which is just funny. And you have talked me through some of those things recently.
Yes.
And I think for me, it's actually trauma it's the opposite. I had a life-threatening illness in my 30s, which was not cancer, but I was so traumatized by that. I was like, I'm never going back in. I'm never going to ask, even though I don't know what it would take for me to be able to go in simply when there's something pretty significant. But as I get older, I'm going to have to figure it out. So
we can figure it out together, and hopefully along the way, using our, because as we age in general, like, all of us are going to have to deal with illness in some way, shape, or form. And if not in us at a certain time, like in our loved ones, in our aging parents that we've talked about, also in our kids. And so, I mean, illness is unfortunately part of being human. Like, no one is going to skate by life without having something happen to their mind or body in some way, shape, or form that perturbs their homeostasis. So let's just accept the fact that we are imperfect human beings in human bodies that are not robots, and that we don't live forever.
Well, so let's talk a little bit about what's different about being a parent and advocating for kids, and then what's different about mental health. And I could just start about the parent thing because you and I are going to differ on this. And I think it's very interesting because I have the same stories about being that patient as a parent because I'm a pediatrician. And so therefore, I can't, well, I can't, so funny. Advocating fiercely for my kids comes at a different level in a different space, but I don't do that in the pediatric realm. I just take care of it on my own. And I have always 95% been their doctor, except if I needed an MRI or a test or something, which I know most people don't do, though my kids are always like, can't you just take care of it? You usually do. It's not that I don't take them to the emergency room. I have boys, so we've been to the emergency room quite a bit when there's an emergency or something I can't take care of. But so I just think it's interesting because that patient story comes up because it's my specialty. And I wonder if that's partly the difference. But I know for you, the medical care, seeking medical care as a parent feels very different.
Yeah. So not being a pediatrician and having a teenager and now a 6-year-old going into first grade, I am a fierce advocate, and I don't care about being labeled as that patient. Like if my child needs something, even if it's like a referral or if something is wrong, I am very, very vocal when it comes to that. And I like to think like very intentionally vocal, not to the point where I'm crying wolf all the time, for instance. For me, it's I don't even give it a second thought. Like it's really funny in terms of talking about this with you, because it's like I could care less what the pediatrician thinks of me. I just want my kids to get the care and attention that they need in the timeliness that's needed for that particular situation.
We'll even say it goes further because you'll often ask me what I think, right?
Yeah.
Either before or after, but you're going to get as many opinions as you need.
Exactly. And I don't care what you think about me asking for the opinions.
I don't mind you asking. I appreciate it. But I just think it's funny to think about it in that way. So I think when we're advocating for someone else, it feels different. I actually have really taught my kids to advocate for themselves. And it's interesting because I think it's turned out well, but I think it comes from being a pediatrician and really not wanting to have to be the naggy, overzealous, worried one. I'm probably not worried enough. They're like, are you sure? I think you should take me to the doctor. I'm like, I think you're okay. Anyway, so the other thing we were going to touch on is just mental health and seeking care for mental health. And I would say that for me, and many of you know, my husband had a pretty significant mental health issue a number of years ago. And it's hard to seek care for mental health. First of all, as a patient, and then as a physician, I just want to add in, if you have a loved one, it's even harder. And it's very hard. And if anyone who's listening has someone they love who's had challenges with mental health, it's really hard to advocate for a loved one with mental health. And there's an amazing book called My Lovely Wife in the Psych Ward that's written by a quite articulate English teacher who talks about his wife's experience with mental health and what it was like to advocate and not be listened to as a loved one because of a lot of the rules that we have for good reason. But I found in my experience that even as a physician and even advocating, that there's complexities there that make it harder. And it's not just the mindset, it's actually the system. And so there's a bit of, in that realm, in the mental health realm, first of all, we don't have enough mental health care. Second of all, it's complex if it's not you and sort of the being able to advocate for yourself or not in certain situations. And then the judgment layer, our own judgment of ourselves, our own judgment of what other people will think. It's multi-layered with complexity and conflict and confusion, I think.
Yeah, there's still a lot of stigma related to mental illness. And especially amongst healthcare professionals, because there's associations with potential punishment or revocation of licensure, for instance, and this fear of not being able to practice in one's vocation because of that is really big. And it is in some respects needed, but also I think it's that fear has become ingrained in a way that has been so not helpful for helping and healing healers and keeping healers in medicine, because it's so potentially punitive, or at least seen as potentially career ending. So I'm just also sharing my own mental health journey that I've openly shared before in the past, of going through therapy when I was a very young cancer survivor, having gone through the healing of my external body, but then wanting to heal my insides as well, between the uncertainty and the anxieties after acute treatment. Because really, after you're done with cancer treatment, it's like, okay, bye, we're going to see you for surveillance. Like, no more treatment. We'll just see what happens. That's kind of how I felt. And I really, really wanted to set myself up for success in terms of healing my insides, to deal with what I knew was going to be a lifelong journey of uncertainty. So that was one. And then the more recent one, but now not so recent because my little one is 6. So it's been quite some time now. But now, years ago, when I was diagnosed with postpartum OCD, part of what I call my kind of incidental, or not incidental, the kind of crisis day that I had, was very close to my board recertification exam. And so there was, a really heightened level of anxiety related to certification for my profession, associated with all of the different natural hormonal changes that were happening in the postpartum period, mixed together, creating this perfect storm of very, very heightened anxiety, and a period of time that was quite scary. And I also distinctly remember that I felt like I could, quote unquote, tough it out and just go ahead and just take the exam. And in retrospect, I was like, what was I thinking? Like, if any of my friends came to me with the symptoms that I had at the time, I would have been like, no, you cannot take an 8 to 10 hour board exam in the state that you're in. Like, the state that you're in is not your fault. First of all, having postpartum OCD is not anyone's fault. And I wasn't able to treat myself in that same way with compassion, because I was so fearful of what would happen if I didn't take my board exam on time. And I had shared in the prior podcast that I actually ended up having to call the board and tell them what had happened. And they allowed me to postpone me taking the recertification exam, and I was able to recertify again on time. But after seeking treatment and getting the okay from all my healthcare professionals that yes, it was okay for me to subject myself to that kind of increase in stress for a board recert exam. So there I was, that quote unquote patient of feeling like I could just tough it out, because I had toughed out so much before that I felt like I could just get it over with and do it. But really the best thing, which my healthcare team had recommended for me at that time, having postpartum OCD, was to really pause and not take the board exam that next week. And I'm so grateful that they really, really convinced me to take that pause.
And we're going to pivot into tips. And I think that's probably the number one tip, actually, would be to pause and just notice all your thought patterns, and notice where you are, and notice how you might be being reactive, or notice how it might be a trauma trigger, or notice how it might, whatever stories might be there, and recognizing that what's going on before you make a decision, because that's more than likely, pausing and hand to heart, going to give you more clarity about whether you should reach out for help, whether you need to go in, whether you need to take time off, whatever it might be.
Yes. So, and mindfulness helps us recognize when stuff arises, mind, body, and spirit, that is seeking to thwart our homeostasis. And I'm going to say this lesson over and over and over again, because this is a lesson that I am going to need reminders on throughout the rest of my life. But you can't care for others unless you care for yourself first and foremost, especially when it comes to your own medical needs. And then I'm going to invite you to ask questions of yourself, and I'm going to actually ask them again in the reflection questions too. But can you give yourself permission to prioritize your needs above that of others? Like, is thinking about the answer, is that even uncomfortable for you? And why is that? What are your barriers? Why are there barriers? And then other tips are invite yourself, especially when you're setting up appointments for your loved ones, like many of you probably already do anyway, like with annual checkups from your kids, your partners, your parents, even your pets. Your pets probably get periodic checkups too. To don't forget to include yourself in your circle of care, and also set up your own checkups at that same time.
And I love that language of also. I find that with many people I work with, they really struggle with the put yourself first. And they can get to that ultimately, because it does make sense, right? You have to put on your own oxygen mask first or you'll pass out. However, a lot of people are willing to put their own on also, or their own on as well. And so can you take care of yourself as well as you take care of others? Or also, including yourself in that circle can be the first dip a toe in if you really struggle to do this work.
And then I'm going to share a quote unquote rule, really rules for this type of topic are like invitations. So I'm going to soften that rule from my oncologist into a 2-week invitation for you. So if like a health ailment arises, it's not immediately life-threatening. Of course, this whole podcast and all the episodes are not medical advice, but if you're dealing with something that's not imminently life-threatening, you can give it usually like 2 weeks, and then or less. If things start worsening, of course, that means that probably some attention needs to be paid a bit sooner than that. If it's still persistent or worsening by the 2-week mark, then that's usually a good time frame from which to come to the conclusion that probably medical attention is needed.
Maybe the rule is never let it go more than 14 days. 14 days or less.
14 days or less, yes. And then also just reminding you, especially from a mental health perspective, that mental health is health, and that getting help helps. Whatever it looks like for your mind, body, and spirit, getting help absolutely helps. But yes, it can absolutely be very hard to ask for help because of what we have gone through, because of our training, because of our upbringing.
And we are at our worst when we are sick, right? We are depleted. We are usually in fight or flight or sympathomimetic storm. And so we are more than likely to go into our old default patterns. So even if you have a great mindfulness practice, even if you have done a lot of work on self-compassion, even if you're very aware of all your thought patterns, you're likely to act your worst, if that makes sense, in the moment. And so recognizing that, and always just reminding yourself that when you feel vulnerable, it's actually a great idea to ask someone else, get their opinion. It's kind. And if there's a safe spot to do that, and then they say, oh, yes, you really should get help, well, perfect. So not overjudging, and just recognizing that, of course, we don't make our best decisions. And that's really a hand to heart moment. I also want to remind folks at the end of just the language component. We called it, you don't want to be that patient. But what if we were all just a patient, and all our patients were a patient, and we took out the adjectives? and took out the judgment, and referring you back to that judgment podcast, that we tend to judge. We were trained to judge. And so can we just notice we're judging ourselves here and take out the adjectives? You are a patient, just like any other patient. Include yourself in the circle of patients in the universe needing care, and all at least equally worthy.
So with that, we like to invite you to join us with some reflection questions. Have there been times when care for yourself might have been delayed due to your own decisions? So, if so, please offer up a moment of compassion and forgiveness, and also trust that you were doing the best you could at the time.
Can you give yourself permission to prioritize your needs above that of others, or as well as others? What are your barriers, and why are there barriers to seeking care?
And how might you approach an upcoming healthcare need for yourself? Because unfortunately, it's going to be inevitable because we're all humans, but with more mindfulness and compassion.
Thanks so much for joining us today. We would love to have you join us for Connect in Nature in September. We have a couple of spots left, and this will be the last chance for you to join us at Green Gulch before we change locations in the future. And you will learn how to practice mindfulness. You will practice, and you will be in a group of people who work in healthcare or related to people who work in healthcare. And one of the things that I have heard from people who've attended is when they've had a spouse hear how we think and how we approach things, it's very, very helpful to be more of a team going forward. And it's very helpful to have this sense of belonging and experience of understanding why we think the way we do. At the same time, practicing mindfulness and self-compassion and being able to head home with actionable tools and a community where you can support yourself well going forward.
Thanks so much for joining us.
We encourage you to dive into the show notes for each episode for more learnings and resources.
We also invite you to take a listen to the many other Mindful Healers podcast episodes, and please share the podcast far and wide with colleagues, friends, and family.
If our message and approach resonate with you, we would love to work with you.
When you listen to a podcast, you consume information, but when you work with us, you can actually practice and change.
We offer coaching and mindfulness experiences, talks, workshops, retreats, and more. Connect with us at themindfulhealerspodcast.com.
The content of this podcast is not medical or life advice. We invite you to participate in the mindful moments we offer at the end of most of our podcasts, but please only do so safely.
Welcome to this mindful moment offering. If it's safe for you to do so, closing eyes or lowering your gaze a few inches in front of you. This practice is the self-compassion break from the Mindful Self-Compassion curriculum from the Center for Mindful Self-Compassion. This exercise can be used anytime where there is some difficulty, where you're facing a healthcare challenge, or if a loved one might be facing a healthcare challenge. So taking a moment to just settle in, noticing the support of the ground beneath you, the chair or bed, seat, cushion that you might be sitting on. Taking a moment to notice what's here for you now, as I prompted you with some possibilities of upcoming challenges, thoughts, emotions, body sensations that are here for you. So this is a moment of mindfulness, of noticing, dropping the judgment, recognizing that of all of the billions of people in the world, there's definitely more than one person who is experiencing something very similar to you, reminding you of the common humanity of living imperfect lives as human beings experiencing challenges, that you're not alone in this. And then giving yourself permission to pause and ask yourself this question in this moment: what do I need in this moment to show myself kindness? What do I need in this moment to show myself kindness? Some invitations for you now in this moment, perhaps some hand to heart, pushing in just a little bit, acknowledging whatever's here for you right here, right now. Or even some gentle, respectful touch for the face, cradling the face. Perhaps taking a deep, mindful breath in through the nose, blowing out birthday candles through the mouth. Knowing that you can ask this question anytime. As you're ready, blinking open eyes, letting the light back in. Thanks so much for practicing with me.